You feel like your biological clock is ticking, but you've been having quite a bit of trouble trying to get pregnant. You experience very heavy periods, maybe even nausea. You may be suffering from endometriosis. Today we take the opportunity in our morning medical to chat with some endo warriors as well as Dr. Damien, gynecologist.
Endometriosis is a chronic condition in reproductive age women, which is associated with monthly pain starting just before and proceeding through the period. It's due to bits of tissue being deposited within the pelvis, which are similar to that tissue which naturally comes out from the womb every month when a woman has her period. So if those bits of tissue are deposited on, say, the ovaries, the back of the uterus, and what's not, they will respond naturally to the woman's hormones, and eventually that would cause a tissue reaction which results in severe pain on a monthly basis. Endometriosis is also associated with pain during sexual intercourse, particularly if there's deep-seated endometriosis in areas such as the cervix or maybe the bowel, and that can also cause pain during passing stool, for example. There's also some association, although it's probably not related to the areas where the tissue is deposited with, but an association with infertility, which for some people it could be explained because it can cause marked distortion of things like the fallopian tubes or destruction of ovarian tissue, causing inability to produce eggs on a monthly basis or those eggs to reach sperm or what's not. But in milder cases, the cause is certainly not as well understood. It's thought that perhaps it might cause problems with sperm motility, or sperm might be eaten up, consumed. Might be some issues with the egg quality, for example. And very often in these cases, though seemingly unexplained from other standpoints, might have to end up seeking IVF for resolution of that infertility condition. So we spoke about pain on a monthly basis. That pain is characteristically starting just a bit before the actual bleeding, and it carries on until the period is finished. They may or may not also have heavy menstrual bleeding, heavy periods with a lot of clots and what's not. So those might be the early signs, particularly if it's just superficial endometriosis. When I say superficial, it means it just on the surface of the organs and what's not. Very often, though, you might just detect endometriosis because it has no symptoms incidentally when you've maybe done an ultrasound and see a big cyst with a particular appearance. It's bright and speckly on the background of black, and that's a typical appearance of an endometrioma, which is a type of cyst on the ovary which results from endometriosis. Or you might see nothing. Symptoms would lead you to suspect diagnosis, but the confirmation generally will come with doing surgery. So we might have incidentally done a laparoscopy for other reasons, like the lady might need a sterilization, or we might be doing open surgery, and we see a few speckles of this dark powdery looking deposits in the uterus, and that might make the diagnosis. But in someone who has suspicion, we might need to schedule a procedure specifically to diagnose it. That's called a diagnostic laparoscopy, where we make a small incision into the belly button and put a camera through, and seeing those classic lesions, which could be, red kind of fire-like lesions. It can be dark powdered type lesions. It could be white and clear, or they could be white and from old scarring, from old disease. Those can pretty much clinch the diagnosis in the mind of a gynecologist. Rule of thumb is generally we suspect that between 6 and 10% of all women of reproductive age might have the condition. It's more frequent in persons who have infertility, so somewhere between 30 and 60%. The American Congress of Obstetricians and Gynecologists certainly quote about 38% of infertile women. And in persons who have chronic pelvic pain, the prevalence may actually be as high as 80%. Pain relief is part and parcel in treating the process. Because this is an inflammatory-like condition, is reaction to bleeding and stuff inside the abdomen. We're going to target that specifically with what we call non-steroidal anti-inflammatory medications. That's things like your ibuprofen, your naproxen, your mefenamic acid, and that's quite specific. For persons who are not concerned with becoming pregnant for the time being, you can use modalities which reduce that frequency of menstruation. So that will include things like your birth control pills, your combined oral contraceptive, we call them, which can be given on the same kind of every monthly basis, or it can be given a bit more continuously depending on the level of severity of the symptoms. If you go one step further and use things like Depo-Provera, which we know as a 3-monthly injection, as an injection to, again, try to suppress the period for a bit longer relief. Of course, we don't give that as something long-term because the risk sometimes of reducing the thickness of bones. Similarly, a class of drugs known as the gonadotropin-releasing hormone antagonists. I'll give some examples. They call things like buserelin, Zoladex, things like Lupron, which is called lupulide acetate, decapeptyl triptyline. Those can also be given as depot injections, but they do have that long-term risk of suppression of bone growth, and as a result, we tend to limit the length of time we give those, and they're mostly to prime maybe definitive treatment by removing tissue at the time of surgery, or in preparation for those who are trying to get pregnant to reduce the burden of disease, that their chances of having a live birth is a bit more better.
The Katrina Endometriosis Fund Association of Barbados is a brand new association, just 6 months old, but already working very hard to ensure that the awareness among Barbadians is built up. And I have the founder with me right now. Her name is Katrina Alleyne, and she is an Indo warrior. That's the affectionately known as title that they have. And we'll be chatting as well with Sasha Amy, who is also a member of the association. So, Katrina, I would like to take this opportunity to thank you for chatting with us on Morning Barbados, first of all. And I want you to tell us a bit about your organization and why you decided to take the bold step and get this started.
Good morning, Barbados. The Katrina Endometriosis Fund Association was put in motion September last year, 2016, as a part of outreach program to the public in Barbados because so many women suffer with the condition. Meeting so many women in hospital on the journey with endometriosis, we came up with the idea to actually have an organization for the condition that we can actually get you, the public, in the know about the condition and the associations with endometriosis.
It started for you, though, from a personal experience. So maybe you can share that and just how long it took you to understand what was happening with you personally.
Well, my experience with endometriosis, my first experience with my period was at the age of 10, and it was a bit excruciating at first, but then as the time went on, at age 13, I was attending the St. Leonard's School, and the pain was unbearable. It took me 20 years to actually have a diagnosis that I have endometriosis, and this was in the attempt of treating a ruptured ovarian cyst that they thought was the problem at first. But after 2 attempts at the ruptured ovarian cyst, they actually decided then to do a laparoscopic surgery because it prevented me from actually being a normal teenager, because it prohibited me from actually doing teenager stuff.
What has the response been like from women that you've approached?
The response has been tremendously overwhelming because so many women in Barbados have endometriosis. One, they were probably just waiting for a voice or someone to actually come out and talk about it, that they can come out their shell, because most women I speak to have the mindset, because anything to do with the pelvic area or the abdomen, they have this stigma attached to it that you are damaged goods, and it's not necessarily the case, because women with endometriosis have families, they respond to normal tasks when they can, so it's not already a disability, but it affects us in many, many ways where on the onset of menstruation we cannot function.
Sasha's experience with endometriosis has taken a toll on her daily life.
My experience, unlike Katrina's, when my period first started, it was painful, yes, but not to the extreme that Katrina had. But as I got older, my periods gradually got worse. And in 2011, I had my first ovarian cyst rupture. And then a couple months after, I had another ovarian cyst rupture, but from then the pain did not stop. And I was admitted into hospital, and that's how I knew I had endometriosis. Having pain the entire time with my period, I never knew that. Like Katrina, I never knew there was anything wrong with it because it was the norm. So I was diagnosed in 2011, and then after that, the pain continued every single day from there. And then I was diagnosed by having a laparoscopic surgery done, and that's how we knew that for sure that it was endometriosis that was causing the pain.
Exactly how debilitating can it be?
Endometriosis for me has been extremely debilitating. It has gotten to the point now where I have to sometimes walk with a cane. It affects everything that I do, from being able to walk, get out of bed on mornings. I have pain with urination. I have pain with defecation. Even the simplest things like making my bed and doing things like that, I have to get help with. Some days I'm not able to get out of bed. And the real challenge is that the pain medications that we use, even as strong as morphine, sometimes those medications are not adequate. So that's where the real challenge is. So even if I want to do certain things, because I'm not able to get the pain relief that is necessary, it makes it difficult for me to do the normal things that I would like to do. So I am now at the point where I'm almost a shut-in. I don't really get out. I'm not able to socialize, not able to get to church. Even doing simple things is very difficult for me. So the situation on my end is not the norm for most women to suffer the way that I do. But unfortunately, my situation is that severe.
Yeah, so we appreciate it even more that you took the time to be here to share your story with us. And maybe that speaks to how important this support group is for you.
Yes, it most definitely is. It's unfortunate knowing that there are other women who have the disease, but knowing that there's someone out there who understands what's going on, because it's difficult for anyone who doesn't suffer from endometriosis to really understand the level of pain and to understand how debilitating the disease can be. So having someone who understands what's going on and who can help to give you support and can help to encourage you is definitely important. And the organization is also really important because it's giving education and awareness. Had I known when I was younger that having that kind of pain with my period wasn't normal, I would have been able to get help before I had the problem with the cyst rupturing. So I know that there are a lot of women now who will get information even from this program, who will be able to go to their gynecologist and hopefully get themselves on a treatment plan to stop it from getting any worse.
Both of you are fairly young women. Do you ever feel like, why me? And I didn't expect to be having to deal with all this at my age.
Sometimes, but I try not to look at it that way and to just always try to look at the positives. Yes. There's always something positive in life. I have a roof over my head. I have a bed that I can lay in. So whenever I'm having those down days, and I do get days where I'm really depressed, I always try to look on the positive side. I have my family who helps me. My sister is always there for me, and my mom, even my nephew, they always help me with everything. So I always try to focus on the positive.
Yeah. Building understanding among the community. And for you, Katrina?
Well, for me, the support has been vast. I mean, just from people that don't even know me, and you're walking on the street and it was like, hi, Endo Warrior, I have endometriosis too, and you gave me the chance to actually fight and don't give up, because most women with endometriosis, the first thing they like to do is give up, because as I say, especially in relationships, and I find a lot of relationships fail because especially with the sexual aspect of endometriosis. So I think a lot of the guys and a lot of the men in Barbados actually needs to get in the know and get au fait with the condition so that you can better understand what's going on with your partner as well.
We're building awareness, creating a different kind of sensitivity, and that's what I think you ladies want, and all those supporters who aren't even sufferers but are helping with the organization. Just over 200 members and at least 25 who are not sufferers but there just to help and support. So Katrina, we wish you every success with the organization, and we hope that this really helps and changes women's and gentlemen's approach to this situation if they find themselves in in that situation. So thank you so much for talking with us, and thank you as well, Sasha, for sharing.
You're welcome.
All right. So this is Morning Barbados. We're trying to make good mornings better, and we hope that that piece of information definitely made a difference for you.